As a therapist at Telos, you must have clinical depth. It's one of your competencies. Your first skill statement says, I see beyond the surface behaviors to the clinical roots of issues. Your second statement says, I'm able to identify and separate co-occurring learning disabilities, mental and behavioral health issues, personality issues, and other problems in my individual treatment planning. What these two skill statements mean is you have the ability to look at the puzzle that is your student and carefully and expertly put it together piece by piece. You have clinical opinions. When asked for observations in treatment team, you don't give vague answers. Your third skill statement is, when I lack knowledge or skill, I seek supervision and other resources to build my competency to that of best practices. There should be no therapists at Telos who are winging it in any area. We always work based off best practices and empirical proof. Your next competency is referral relationships. You should develop relationships of trust with referral relationships. You cannot see them as an afterthought. They're trusted team members who are entitled to timely and accurate communication. Your next competency is maintaining an aftercare focus. It's never too early to start planning for what's next. Your first three skill statements have to do with educating parents of the benefits of a home team, TAS, and Telos Anthem House. You should also have students leaving with a clearly defined, concrete, comprehensive home contract and aftercare plan. Remember the old saying, if you fail to plan, you plan to fail. And it's certainly true with students going home. Your next competency is suicide assessment. You need to view yourself as the gatekeeper to safety when it comes to suicidal students. You have the training, you have the judgment, you need to make wise and clinically informed decisions. Your second skill statement says, I assess students displaying suicidal symptoms or gestures in a timely manner, taking all necessary precautions to keep them safe. When you do assess for suicide, remember that you have a program at your disposal. You have all kinds of resources to keep these boys safe. Make sure you use them. Regarding safety for suicidal students, remember the buck stops with you. Don't be the nice guy just because a student wants to be off safety for the weekend. Keep them on safety until they're truly ready and committed to be safe. Also, remember to document why you think they are safe.